So my name is Julie. I am a peer program coordinator for Spinal Cord Injury Ontario in the London area. I've got a couple of behind the scenes as well as co-presenters with me today. So Jess Bree, who is a peer program coordinator in the Toronto area, and Nancy, who is a video content developer with us at Spinal Cord Injury Ontario. So we've got a great session planned for today. Over the last few months, our Knowledge Exchange department has developed a series of videos on self-catheterization for individuals with female genitalia. So you can check out all of these videos on our Coretree YouTube page. So this link will be provided in the thank you email, and Jess Bree will also put that in the chat box as well, if you'd like to check that out. So the way our session is going to run today is we will be showing a couple of the videos that we've done. So the first one will start with Jess Brees, who will show her demo, how she does her cathing in bed. The second will be Jackie, who shows how she casts in a public washroom. And the third will be Nancy, who will talk about how she does her catheters, and she'll share a couple of videos of tips and tricks as well. So after the video, we'll start with Jess Bree. After the video is shown, everyone is more than welcome to ask Jess Bree any questions and make any comments. Once all three of the presenters are done, we'll open up and anyone can share their tips or tricks that they've learned along the way, experiences that they would like to share. That's what these sessions are about, is just us as a community sharing experiences so that we can possibly help others. So we will go ahead and start with the video for Jess Bree.
This video demonstration will introduce you to a first-person point of view of self-catheterization with the person sitting up in bed. It's important to note, this is a demonstration of how one person does self-catheterization. Because everyone is different, your level of function and ability, as well as input from your healthcare team, will help you determine what works best for you. First, always try to ensure you're using a clean environment with clean surfaces. Before you position yourself, place a clean catheter and all the needed supplies within reach of the bed's edge. This can include gloves, if used, a catheter, lube, baby wipes, or alcohol-free cleansing wipes, a blue pad or soaker pad, a mirror if you use one, and a urinal or urine collection container. Once the supplies are ready and you place the blue incontinence pad on the bed, you'll transfer yourself over. Once on the bed, you can shimmy side to side to remove your pants and underwear, removing one leg at a time. Now you'll raise the head of the bed into the sitting position. At this point, you could line up the blue incontinence pad under yourself or fix any wrinkles in it. Position your legs with your knees pointing out and feet facing in. Note now, people whose spinal cord injury is new to them may be using incontinence briefs with pull tabs. If you are wearing these, not regular underwear, you would put the blue pad on top of the incontinence brief so the brief doesn't get wet. Once you're in position, lay the mirror and collection container close to your pelvic area. At this point, you may need to shimmy yourself into a better position to be able to access the mirror and container while still being able to see yourself in the mirror. Now that you're ready to open the catheter, make sure to put on your gloves first. Open or prep the wipes. Now you'll open the catheter wrapping and lube the catheter. Using one hand, you would now spread the labia. Using the wipes, clean the area using a front-to-back motion, once to the left, once to the right, once in the middle, and using a new wipe each time. Keeping the labia open if possible, pick up the catheter and remove it from the open package. Using the mirror, guide the catheter toward the urethral opening. Insert the catheter until the urine begins to flow, and then insert it another 1 to 2 centimeters, but no further. Once the urine flow stops, pull the catheter out little by little to empty the remaining urine. Then pinch the catheter to stop the flow from going back up the catheter and remove it. Now you can wrap the catheter up in one glove and use the other glove to pick up all the trash and use it to wrap the glove the catheter's in. Do a final wipe from front to back to remove any remaining lubrication. Place any remaining trash in the glove. Then transfer everything back to the bedside table. Now you straighten your legs and pull your pants up to where you can reach them when lying down. Then put the head of the bed into the flat position and roll side to side to pull your pants all the way back up. Then transfer back into your chair, empty the urine container, and throw out the gloves. Remember, after you get urine flow, insert the catheter another 1 to 2 centimeters more, unless you feel any resistance. Finally, when you're self-catheterizing in any position or location, it's always important to maintain the cleanliness of surfaces, supplies, your pelvic area, and the catheter. Have all your supplies ready and within easy reach. Find a comfortable and safe body position. And always go slowly and gently. If you ever have any questions or concerns about catheterization, reach out to your healthcare team.
Okay, so we've got Jaspreet. Jaspreet, if you just want to unmute, just introduce yourself, and then if anyone has any questions for Jaspreet, I know she's more than happy to answer anything.
Sorry. Oh, hello everyone. I was just trying to figure out my computer. What am I trying to share? So I'm one of the Toronto peer program coordinators, our peer support coordinators. So Julie's in London, I'm in Toronto. I've had my injury for 19.5 years. It affects me at the C8 level, and it's a complete injury. And so the video that you just saw, that is the way that I used to catheterize. Right after my injury, while in the hospital and when I came home. And the video that you'll see next with Jackie is how I transitioned to doing it after coming home. And now I have a Mitrofanoff, and so that's just another procedure that you can get, and I catheterize sort of out of my belly button. So I'm here to answer any questions that you have around, I don't know, catheterizing in bed or just intermittent catheterization, anything about Mitrofanoff. Please ask anything.
So if you'd like to ask a question, please go ahead and just use that raise hand icon, or you can use the chat box as well, which at this point I don't see any questions in the chat box. But we'll give everyone a minute if they do have any. Or if you can't find the raise hand out or icon, just you can shout out your question as well. Jackie, yeah, of course.
Just maybe to get people going, could we ask a few questions about the Mitrofanoff?
Sure. Do you have you can ask questions. Do you have
A
a
quick
question?
question?
Yeah.
Okay.
Or should I just talk about it in general?
Yeah, maybe from surgery to.
For now, for sure. So the Mitrofanoff is something that my urologist spoke to me when I'm not actually sure if she just sort of brought it up or if it was because we were also talking about my bladder size and I needed to go in for surgery to have my bladder enlarged, and she told me about the Mitrofanoff, and there are two that I know of. So there's the Mitrofanoff procedure and there's a suprapubic procedure. Mitrofanoff is what I have. I spent I leave a couple of days in hospital for them to do it. And they essentially connect your bladder to the outside of your belly. How they do that, I do not know. I did have my bladder enlarged, so they used a piece of my bowel to do that. I don't know if the piece of bowel is also what they use to connect it to the outside of your belly. So this might just be for myself and not for other Mitrofanoff users. Because of the bowel that they use to enlarge my bladder, I irrigate my bladder on a regular basis, on a daily basis. But essentially for the Mitrofanoff, I see, just like I did through my urethra, so I still have to lube the catheter. I still sort of clean the area, but I no longer have to take down my pants. I sort of just pull down the top of my pants, stick in the catheter, and do the 1 to 2 centimeters as it says in that video after I see urine flow. And I just sort of pee out of that space in my belly button that the hole is in. I don't know. I feel like I should have better words for that, but it's really easy, and I've found it to make my life just a little bit easier in terms of how many times I'm able to cath, how often I do it, and I don't have to sort of worry about the shimmies that I have to do or I had to do in my chair to get my pants off. Or I don't know, just any other like risks that I worried about doing I had with catheterizing in my chair. It's really easy just to do it from your belly button, um, or the side of your belly, wherever you get it. And I
Just
did see
a
some
comment,
comments come in.
Jaspreet.
Yeah.
I'm just gonna let everyone know, just if they haven't seen it. So there is a comment from a coworker of ours saying we made a video about bladder surgery options a couple of years ago. So we'll include that link with the thank you email that everyone will get after the presentation as well. And then there is a question. I see there's another hand up. I'm just going to read the one question in the chat box. It says, is everyone that sterile? After 36 years in a chair, I can tell you I am not that sterile. Which is an interesting question.
Yeah, it definitely is. I think if I answer for myself, like, that video that we did, that is definitely, I think, sort of just how you learn it out of hospital. And when you're in my own home life, I think I've gone through like ups and downs of like how clean my method is. And I think they do change it from sterile to clean when you're in the community, because I don't know the reasoning, but I think it's supposed to, we call it clean in the community, or that's the way it's been known to me. And so I do definitely try my very best to make sure I keep it as clean as I can because I don't want infections. But also, yeah, maybe not as clean as it was in that video. But definitely do try to keep it as clean as I possibly can because I don't want an infection. I've had some infections that have taken me to the hospital, and it's not a fun experience when my temperature is so high and all of that happens. Maybe not as clean as that video, but definitely as clean as I can have it. And then different circumstances means different things. So I know in my home personal space, I know exactly where my supplies are. I know how to do it. But then when I go into work, it's a little bit different. When I go into the community and I have to use the bathroom at a mall, that's a little bit different. Using the bathroom at my parents' house is a little bit different. So it does sort of change up where you are catheterizing. I will stop talking because I see that there is a hand up.
There is. Diane, go ahead.
Just a couple of questions and to address two with infections. I struggle with bladder infections. I get them at least once a month. One thing I do think might help too, because I don't wear gloves and I'm trying to do the bed intermittent catheterization, because I've always done it from the toilet, is I will use a hand sanitizers. I will hand sanitize my hands before I'm to insert that catheter. I'm hoping that makes a difference because I can't do it with gloves. I find it uncomfortable with gloves and so my question also too is with that procedure you had, that surgery, how did you say it, Mitronoff?
Yes, yeah, Mitroff. I
Yeah.
call it Mitrophanoff. Different people call it different ways.
Okay, does that reduce the amount of bladder infections by having that?
So I can't say for everybody. That's definitely a great question to ask a urologist. For myself, it definitely did limit the amount of infections I had. And I haven't really thought about exactly why that might be. And as you mentioned, the hand sanitizer you mentioned, you'll see that in the next video that we show you or Julie shows you, because hand sanitizer is definitely used. For myself, it definitely did reduce the number of infections, but I'm not really sure exactly why it was that. I do think that's a good question for a urologist. I can't say just having a Mitrophanoff does increase or it does decrease them, but it did for me. But it might just be because there was just a lot more that went into ensuring the area was clean and sort of, yeah, I don't know. Maybe, I don't know. Yes.
Okay, because I'm struggling right now in the sense that transfers are becoming challenging for me. So that's why I'm looking at doing it from my bed, doing it from my wheelchair, but doing it from my wheelchair is even more challenging. And I'm scared to have that surgery. What was your recovery rate like? Like, was it, like you said, you were in the hospital for a couple of days?
I think it was a couple of days to a couple of weeks. Again, not the best memory. Um, I now, when I talk to any peer about it, I always say, please ask your urologist a bunch of questions. If you can, talk to your physiatrist at Lyndhurst. At that time, I didn't have a physiatrist at Lyndhurst and I wasn't connected with Lyndhurst. Completely different story. I had a wound situation, and I learned the value of having a physiatrist, at least for myself, at Lyndhurst that was on my surgery journey with me. And so I think I would have benefited from having someone at Lyndhurst be on that journey with me during my Mitrophanoff procedure. I didn't have them at that time. I only worked with my urologist at Sunnybrook, who was wonderful, wonderful, wonderful people, and I still continue to go there. But I didn't have like a protocol that I followed after. I have a friend who had the Mitrophanoff procedure who worked with a doctor at Lyndhurst at the same time, and they were sort of provided with like like a guideline on how to rest afterwards. And so I think if I was to redo it, I would have had a hope to have like my physiatrist on my team at that time. In terms of recovery, mine didn't I had my recovery for my actual Mitrophanoff situation went fine. But then the incision I had didn't heal the best. So I had to go through VAC and wound care to have that healed. But the actual Mitrophanoff procedure was wonderful. It was great. It healed well, just my incision didn't. And I almost wonder if I had had that physiatrist on my team, that could have sort of given me a proper protocol to follow, like they did for my wound surgery, if it might have gone a bit differently. But then as I say this to you, I don't want to promise you and say that physiatry at Lyndhurst can just give you some sort of protocol. I just, in my brain, I think it would have been nice for me to have a physiatrist on my, know that is a procedure I was going through, because they have been helpful with all Mitrophanoff things since then, or since having a physiatrist.
Okay, thank you.
Thanks, Diane, for your questions. There's a couple things in the chat box. So just brief. So after surgery, if you're catheterizing through your belly button, If you have an infection, will your bladder leak through your belly button or through the urethra?
I leak through my urethra. For my belly button, there is a little bit of discharge, so I know individuals that will cover it with like gauze or bandage. I don't do that necessarily. Sometimes I'll put a little piece of gauze over it and put my pants over it. But no, I don't leak through my belly button. If I do leak, I leak through my urethra. So I do still, even not just with bladder infections, but with drinking, I have to be careful of that. So if I'm over drinking, I will leak through my urethra.
Okay. So there's a comment sort of going back to the sterile part. This person says, definitely not that sterile since we are catheter users, our bladders are colonized by bacteria. And then another question, again, Jaspreet, about the Mitrophanoff. Are there any indicators of who is a good candidate for the surgery or someone that it wouldn't work for?
Again, I wouldn't be able to say for sure. Definitely a great question to ask your urologist. They suggested it for me, and then I went and spoke with some people or peers that I knew that had it or were getting it. But I'm gonna say I wouldn't be the best person to answer that question. Definitely ask your urologist, ask your physiatrist, ask your family doctor.
Okay, and then it looks like we've got one more comment. If you are getting bladder infections, from my personal experience, I changed catheters to one with, I changed catheters to one with a patented tubing material that creates less tears in the urethra, and then in brackets it says Lofric, I think that's how you pronounce it. I used to get 3 to 4 a month for my first year. So I guess something even as simple as trying to change what type of catheter you use can make a difference. And then thank you, Jaspreet, for sharing is another comment.
Thank you for having me.
Okay, so next we're going to get to show Jackie's video. I mean, Jaspreet, we're all here for the whole duration of the time. So if there is more questions you think of after, please feel free to ask. But for right now, let's show Jackie's video. And it's her cathing from a public washroom.
In this video, we're going to demonstrate how to prepare for self-catheterization when using an accessible public washroom. It's important to note, this is a demonstration of how one person does self-catheterization. Because everyone is different, your level of function and ability, as well as input from your healthcare team, will help you determine what works best for you. Also note, people with more mobility may be able to transfer onto the toilet and be able to tilt their pelvis. Others may choose to avoid the transfer and use the technique shown. The first step of self-catheterizing, no matter what your physical positioning or the setting you're in, is to ensure your hands, pelvic area, and catheterization supplies are kept as bacteria-free as possible, and you have all the required supplies organized and within reach before you begin the catheterization process. Keep in mind, though, you may not always have access to a setting you know is perfectly clean, like when using washrooms in a public space. But, as you'll see in this video, there are still best practices you can follow to help limit your exposure to bacteria, including cleaning your hands after touching anything but yourself or your supplies. After entering the washroom, you'll want to do a scan of the space to get a sense of how and when you can wash your hands, if paper towels are available, where you can dispose of waste, and most importantly, how and where you'll position yourself to self-catheterize. Although you'll want to use hand sanitizer to do a final hand cleaning before touching your pelvic area and catheter supplies, it's good practice to do a thorough hand washing at the sink first before positioning yourself at the toilet to remove any visible dirt or grime. To keep your hands as dirt and germ-free as possible while moving to the toilet to position yourself, you can use paper towel or gloves for touching your wheelchair controls or wheels to move to the toilet. You'll want to position and lock your wheelchair, leaving enough space between the toilet and the toes of your shoes to allow you to lift your feet. If the washroom space allows it, positioning yourself beside the toilet provides more lid space to position your feet. Before positioning your legs and feet on the toilet, make sure your cleaning and catheter supplies are placed within easy reach, so you won't have to touch anything but yourself or your supplies once you're in position. Plastic is less slippery than porcelain, so be sure the seat's down before positioning your feet. You can use a paper towel to do this, and then set the paper towel aside where it can be collected once you're finished. Depending on your mobility and preference, you can lift your feet to the toilet by the ankles, lower legs, or by using the loops on your shoes if they have them. If possible, slide forward in your chair to allow for some pelvic tilt. Note though, you don't want to be too close to the toilet because this can put unwanted pressure on your feet, which could cause them to fall into the toilet. With your feet on the toilet, you'll position your feet and legs with the soles of your feet facing together and your knees pointing outward. Now you'll prepare yourself for pelvic wiping and catheterizing by unzipping or removing any clothing you'll need out of the way. This might involve popping one knee out of your leggings or pants. Now that you're fully positioned and ready to catheterize, before handling your supplies, use your hand sanitizer to do a final and thorough hand cleaning. Once your hands are clean, it's time to make sure your catheter, leg bag, and pelvic wipes can be reached without needing to touch any potentially unclean bathroom surfaces. Now, you're ready to open the catheter. This is usually easiest if you pull the front of the catheter package away from the back. This approach is especially helpful if your hand function is limited. Some people may use a combination of teeth and fingers to pull open the catheter packaging. Now you'll attach the catheter to the leg bag. Take the catheter at the top, that's the end where the colored tip is a bit wider, and connect that end to the leg bag. This type of bag is useful because it has holes in the corners, so you can either hook your finger through the hole or use the leg strap to strap the bag to your leg or wrist so the bag doesn't fall. You're now ready to lubricate the catheter. Using the catheter package to hold the catheter to keep it as clean as possible, open it more, squeeze some lube on, and pull the catheter out while rolling the catheter through the lube. Note now, before cleaning your pelvic area, if you think you've touched anything other than your own supplies, you should use your hand sanitizer once more. Now use your wipes to wipe down once on each side and once down the middle, using a new wipe each time. Use your fingertip to locate the urethra. Place your finger beside the opening and use that finger to help guide where to insert the catheter tip. Now slowly continue to insert the catheter. Once the urine begins to flow, insert the catheter another 1 to 2 centimeters. Then lower the leg bag. When the urine stops flowing, gradually ease the catheter out. Then pinch or bend the catheter to make sure there is no backflow. Let the catheter drain down into the bag until the catheter's empty. Now remove the catheter from the leg bag. You can hang the urine collection bag on your chair or wrist until your feet are down and repositioned in your chair. Wipe any excess lube from your pelvic area and wipe your hands. Then you're ready to zip up your pants or slide your leg back into your pant leg. Now you can lower your feet. Then collect any waste to dispose of when you move back to the sink. After emptying the leg bag into the toilet, you're ready to move to the sink to clean and store your supplies. Once at the sink, you can rinse the leg bag and dry and wrap it, wash your hands, and put all your supplies back in your supply bag. Remember, after you get urine flow, insert the catheter another 1 to 2 centimeters more, unless you feel any resistance. Finally, when you're self-catheterizing in any position or location, it's always important to maintain the cleanliness of surfaces, supplies, your pelvic area, and the catheter. Have all your supplies ready and within easy reach. Find a comfortable and safe body position, and always go slowly and gently. If you ever have any questions or concerns,
Okay, so that was Jackie's video. Jackie, if you want to unmute, just introduce yourself and then we can take questions.
Okay, hi, I'm Jackie Kinahan. I was injured in a motor vehicle accident in 2002 and at C6, C7. And so I have a minimal amount of sparing, so I'm lucky enough to be able to use my fingers to some extent. So that kind of helps me at my level of injury. You can see in the video that I guess I forget how awkward my hands look until I see them on the video, but I can get the job done. And I think that was part of the reason that I agreed to do this, because I wanted to make sure that people knew that you didn't have to be a para or skinny or whatever in order to maybe make things work for yourself, because staying at home and having to be in bed every time you want to empty your bladder just doesn't give you much of a life.
Mhm. And I think that's why for this session too, we wanted to show, and if any of you have already seen the videos, I apologize to rewatch them, but thought it's a good idea to show the videos first so you can get a sense of how Jeffrey and Jackie do it as opposed to them just trying to kind of talk through it. There is a question, Jackie, do you throw out the bag after one use?
No, I don't. I rinse it out and reuse it. Like wash the outside and rinse it out and reuse it until it falls apart, basically. Usually what gives is the hole at the top where you're putting your finger in to support it, or sometimes the little flip valve will fall apart. Those bags cost about, I don't know, $5 maybe. So yeah, you wouldn't want to throw it out every time. Some people I know use kind of like almost like just a Ziploc bag that they zip almost closed, and like if you were in a crisis and you needed to do something, like a Ziploc bag or a plastic bag that you could put the nozzle into and somehow grip it, would save you, from not having anything. I tried things like pop bottles, an actual urinal and stuff, but this at least is a closed system so that pee doesn't end up where you don't want it.
Okay, the comment was good to know, thanks. And then Diane, go ahead, you've got your hand up.
Yeah, again, a couple of questions here.
Yeah, of course.
Have you ever tried it where you used a male catheter that's longer and just had to go into the toilet?
Well, I am using a male catheter in that picture or in that video.
But if you added an extender or the actual catheter,
Yeah,
would it reach the toilet?
That was suggested by one of the nurses after I made the video, and I have not tried it. Either, like, that would probably work, and especially if you were small enough to get closer. I have a friend who, she doesn't put her feet on the toilet. She goes to the front narrow end of the toilet, puts her feet on the ground and pulls her chair in as tight as she can to the toilet and kind of uses the toilet to make her knees go out.
Okay,
And
because,
she d-
yeah,
And
'Cause-
she just empties it right into the toilet, so she doesn't need to bother with the bag.
right. Because my question is, this is all new to me. So today, this morning was the first time I tried to do it on the toilet. And I just can't get my pelvis high enough to have access to my urethra. What would you suggest for that? I just couldn't access that area.
While sitting on the toilet.
No, I was in my wheelchair and I scooted
Oh.
as far as I could, and I wanted to do it with a male catheter, but I couldn't get my pelvis up high enough to have access to that
Are-
area.
Are you putting your feet up?
I tried both. I tried them down, I tried them up. And I still couldn't get
Okay.
enough.
Yeah, I find like sliding as far forward as you can safely. And then having your feet up gives me enough tilt, but everybody's body is slightly different. You'd have to play with it to see how much. What if-
How do you though? Because I scooted as far as I can without falling out,
So where do you normally calf?
off the toilet, on the toilet.
Right on the toilet.
Yes.
Okay, so you're kind of you're underneath you're underneath yourself. I'm just trying to, everybody's anatomy is different.
Well, like when I'm catheterizing on the toilet, no issue, but now I want to do it from my wheelchair.
Right.
And that's where I can't get my pelvis scoot anymore.
Yeah, and you leaned back, your shoulders
Yeah,
back.
I was leaning back,
Yeah. How much dump is in your chair?
not much.
Like what kind of cushion do you have?
I have the Vicare, the care,
Sorry.
the Vicare, Viceir.
Is it hard?
It's
Is it
almost like a
soft?
Roho. It's one step up from a Roho.
Does a Roho is the one with the air bubbles?
Yes, and these ones also have air. They're just triangular cells, but
I
I'm
wonder if
wondering
that's the problem that you're sinking in,
yeah, I wonder. Yeah,
because mine is kind of like a harder surface with a kind of a jelly top on it. So I don't, like, I move forward to get away from the dump at the back, right? But I
Right.
don't, I'm wondering if does anybody else have that experience, that with an air-filled cushion, it's harder to get a pelvic tilt?
I heard it is, but I've also been told someone with a Roho can do it, but I hear it's harder with a Roho.
Hmm.
And mine is very close to a Roho. It's just a step up from it. But I don't know if you have any suggestions on how to get my
Yeah,
better angle.
I'm thinking, is there, yeah, I guess, I don't know, would the nurses at rehab maybe have?
Well, I'm
Well,
wondering about an
I-
OT as well.
Yeah, so I had a Roho, and I've been able to sort of scoot in a way to do it. You mentioned that you had tried it for the first time today. Not easy. I remember trying it for the first time. It does take, I mean, practice, so you might just sort of have to figure out just like, like this is getting a little much, but like in terms of anatomy, like I know like um, my urethra is a little bit to one side and then the other side. It's not like completely in the center of me. And so just in terms of like shimmying myself, I know that I lean one way more than I lean another way. So like, just in terms of like just like Jackie said, like everyone's, like everyone it just sits differently or everyone is just different. You might just need to practice a little bit. And then in terms of positioning your legs, like I've attempted to keep them on the ground, but then putting them in the toilet was a lot easier to do. I saw how and everyone's bodies is different as well. I saw how Jackie's legs are in the video. I remember I used to put my legs a little bit like I would put one leg up and one leg down. So like everyone does it a little bit differently. So you might just have to practice and play around with a little bit. I wonder if the Lyndhurst nurse would be able to practice that out with you. I know someone said that, and Julie said an OT. I've heard both can do that. I did work with a nurse. I mean, I was not at Lyndhurst, I was at Blairview, but I did work with a nurse to do it. So I wonder if your physiatrist could have like an outpatient nurse sort of guide you through it at least once or twice.
Yeah, I have had
practice.
that, but yeah, no success.
Mhm.
I'm also, I don't mean to take up everyone's time here. My other question is, I'm doing it head on. Is it better to do it from the side of the toilet then versus head on?
Are you practicing at home?
Yes,
Do you have like a bath bench or something?
no,
What about a chair, like a place where you could use a chair?
use
Just,
a chair.
well, just because a chair might be more stable for you to put
Oh.
your feet on, less likely to fall into the toilet, whatever, so you can kind of work it out, and then once you get the hang of it, then
Move
maybe
to the toilet. Yeah, I was thinking that. Okay.
like
Yeah,
just putting your feet on something that's maybe a bit more stable than a toilet. So you
right.
can play a bit more with, or you can maybe raise the height a little bit. Maybe it's just the height. You know, if you can get your legs up a little higher, then maybe the cushion doesn't have the same
Okay,
effect.
thank you.
I don't know. It took me a long time, like and I've had many a frustrated moment and gone through like more than one catheter in a session trying to get it right. And, crying because my bladder was full and I had to get it empty and I was panicking and, that kind
And
of.
and I don't, if someone else has questions, they can go ahead of me. My other question would have been, if you have time, is what kind of mirror are you using to do it from your wheelchair? Because I can't see what I'm doing as well.
I don't use a mirror because I can't find a way to balance it. Once you need to figure out if you have feeling in your pelvis, when your finger touches your urethra, or you have to work it out that you need your finger to recognize what the feeling of your urethra is to
Okay.
landmark it.
All right,
I don't use a mirror.
all right. Thank you.
I didn't use a mirror either, but I will add to that mirror question. There are, and I don't know, and maybe Amazon, maybe the internet, maybe the nurses, maybe somewhere, but there are, when I first started practicing at Blairview, they did have a mirror and I found it difficult to use it. So I eventually did stop. But there is one that sort of wraps around your leg. So your leg holds the mirror in place. So there are mirrors out there. Um, I don't know if it was specifically designed for this or if they just sort of found it and used it for this. But there are mirrors that have like an attachment that can wrap around your leg if that's something you're looking for.
Okay, thank you.
I just want to point out too, and I don't know if anybody caught this, and Jackie, I hope you don't mind me sharing, because it was in the video that Jackie has a zipper that she uses. And I don't know, Jackie, maybe if you want to just, again, it was a little bit harder to see, and I don't think it was actually pointed out in the
Yeah,
video.
I was just should I just grab a pair of pants? Maybe I can hold it up to the
Yeah,
camera.
for sure.
I didn't have a zipper, but once I learned Jackie had a zipper, I thought it was the most wonderful thing. It would have made my life so much easier.
It's brilliant, absolutely brilliant. And she wants, and she'll tell you, but she likes to get them similar to the color of her pants so that they're not super noticeable, which makes it a little bit harder to see in the video. And that's why I just kind of wanted to point it out, because it is brilliant.
Okay, these pants are inside out, so maybe you can see the zipper better. But it's just in the crotch of your pants from side to side. So I'll just turn it around maybe. But you're right, I go try to make it match really well, so then it's harder to see the actual zipper. But so it's side to side is what I do. Some people go front to back, and maybe that is, depending on your anatomy, how much further back it is. Like if I can't remember the lady who was asking the question, if she maybe if the toilet transfer is not hard, but pulling down your pants is hard, putting the zipper side to side means you could still sit on the toilet and do it. But you wouldn't have the stress of trying to take your pants off. And the other thing I found too is that you don't need a heavy duty zipper. That just makes it show more. Just a regular zipper is fine. And if you have any kind of finger issues, you know, you can put a little string on there and make it easier.
Thanks, Jackie. Couple things in the chat box. So there's a question. Does anyone have advice regarding using a catheter directly over the toilet with female and or male catheters? I currently squat over the toilet and use female catheters, but struggle when trying to use a male catheter.
Because of the length?
Yes.
Of the length?
Yes, so
Um,
I actually transfer onto the toilet, and that's my IC while sitting on the toilet, and I'm using a female catheter doing that. Struggling when using, so yeah, so I use the female catheter like that, so it's much shorter. And I have another catheter. This is a pre-loop catheter, and this is much shorter. It's like a 10 centimeter long. So when I use this catheter to ice directly on the toilet, the urine just flow into the bowl. It doesn't, I don't even need a collection container, so it's very convenient. Whereas this one, it's a traditional length, but it actually hangs over outside of the toilet bowl, so you need a collection container. And also because it's so much longer, it's kind of, it wobbles. It doesn't, it's hard to aim into your body. So what I do is I cut this shorter. Like I cut this while it's still in its package, and I cut it to the length that's similar to this catheter.
That's a good idea.
yeah.
Yeah, and you don't need a gauze anymore, right? So that's how long it is, and that's all you need. That's all you need to do IC on a toilet bowl, and that's the ideal length. Yeah.
Smart.
Okay, so there's a comment, catheter suppliers will provide mirrors, but noted that they're very difficult to use. There was another person that has said that they received a leg mirror for free from Coloplast. Question for you, Jackie, is who put the zipper in?
I use like whoever does alterations at a dry cleaners or whatever. Some are better at it than others if you find a really good one. If you're lucky and you have an auntie or a grandma or a mom, I used to be able to sew, but I can't make that happen anymore like as tidy as somebody who's good at it can do. They do charge though, I will warn you on that one. Aunties don't, grandmas don't.
Another comment, the Loric L is fantastic because of the handle. That's obviously a specific type of catheter. I don't know if anyone's heard of that or what brand that's from. Yep, go ahead if you want to.
I have one I could show you. Just let me grab it.
Sure, that'd be awesome. Thank you. And Nancy, sorry, do you want to just introduce yourself as well? Because we just heard from Nancy.
Oh, yes. Hi, guys. I was injured exactly 20 years ago at the level of T12, L1, and L2. And I have, my hands are, well, like they're perfectly functional. And I do have a good transferring skill, so I'm able to transfer over to the toilet and do my IC on the toilet. But during the first 10 years post-injury, I did not do IC. I was trying to push out. I just thought that, hey, I might still have the ability to pee by myself. Why should I still do IC? So what ended up happening was I had a terrible kidney infection at the 10th year point, not knowing that tried to push out urine would not empty my bladder effectively. So anyway, I don't think that's a scenario for everyone else, so I'm not gonna elaborate on that. I'm just trying to say I was not very well educated when I was I guess I didn't have the motivation to learn to do IC the proper way, the effective way. And now I look back, it was not even that difficult. If like I think what prevented me from learning was I thought I would never be able to do it independently. But now it's actually not that hard. So I wish everyone would learn it the proper way, and it actually will really help avoid infection. I do have two very short video to show. One is how I would lubricate a catheter. It's how I have been doing it for the past 5 or 6 years, and I think it's a much time-saving way of lubricating a catheter.
In this video, I'm showing you 3 ways of lubricating a catheter. The common way is to use a single pack of lubricants per IC. You tear up the opening and insert the catheter. If you have a much longer catheter like a male catheter, you can tear up the other end of the pack and lubricate it this way. Those two are not my favorite methods because you will end up with a lot of jellies still left in the package. The following is my favorite method and have been doing it for many years. I will use a tube of lubricants like this, and then just carefully insert the catheter into the opening. It's important to keep this tube sanitized, so whenever necessary, just use a cotton ball dipped it in rubbing alcohol and wipe over the entire surface area of this tube.
So that is the first video. Again, if you're not confident about keeping this tube sanitized, do not use the third method. And I had another short video, a tip video on how I contain my catheter. So today I'm going to show you what I use as a catheter container, useful for females with a shorter length of catheter. So what I use is a regular food container, plastic, but it's transparent. Those are all standard length for a female catheter, so it fits perfectly well. I also include a pair of glasses. This is used when I get up in the middle of the night to go to the bathroom so I can see. Okay, here's one trick. And notice there is an opening here. So every time if I have to pull out a catheter, I'll just use this opening to do it without opening the lid. This is a perfectly waterproof container, and if I accidentally knock this down on the floor, the catheter would not spread all over the floor.
Good idea too.
Thanks, Nancy. I'm going to go
Yeah.
back to the chat because we're going to backtrack just slightly. There is a comment and question. This is to Jackie. So I would, about the zipper, I would think any seamstress could place a zipper. I heard 9 inches works. What length do you use?
I used 9 inches. I found 7 a bit small, and more than 9 inches excessive. It's too obvious. 9 works.
Okay.
Maybe if you're a small person, 7 is fine too.
Comment, not Loric Lafric. Okay, I apologize because we've gone, oh, is that one there? Oh, okay, so here's a,
Yeah, so this is the one, it's all like sort of contained like that. And then you, it's been used once, so I watched it, but you kind of take it apart like that.
Okay.
And then there's a little like thing that you open to so that the urine flows out. And then, so this is kind of like your regular catheter, right? But the part that you took off now goes in this little hole. Again, because it's used, it's a little hard to put in, but it kind of, oops, kind of goes in there. So that now becomes like your handle, like you don't have to touch the catheter at all. You know, or the funnel,
Very
like it's got a little
cool.
funnel in there. I thought it would be really hard to use like in the toilet, but actually I was surprised I could use it.
And what brand is that?
Yeah, Low Frick,
Oh, that
L-O.
is the brand. Okay.
Yeah, that's
And
the
that's
brand.
in the chat box too, if anyone would like to write it down or look it up.
And I wrote them asking for samples and they sent me 5. So, you know, definitely ask for some samples and then give it a try before you, I don't know how expensive they are. Never did buy it, but
Nice. Well, thank you for sharing. That's great. I think there's another comment. So this is to Nancy. Thank you, Nancy. I use pre-coated catheters and find I struggle to hold onto the tube part. I find I hold onto the plastic funnel type piece at the end.
What
Yep,
about the
Jackie?
gauze, that gauze technique that you have a video for would maybe help you hang on to a pre-lubed catheter? Because that's why I don't like them either. I can't hang on to them. They're too slippery.
Oh, I don't have a video on that, but I know there's another video where the lady was talking about holding the catheter with a cloth. Yeah.
It's in the group that we just did, right? Like,
Yeah, yeah. We can
um,
also send that video in the
I think it's called what, landmarking and gauze technique, or
Yeah.
gauze technique and landmarking.
Mhm.
Yeah, so we can send, okay, so Tori just put the link in the chat box. And again, that's a link we will send in the thank you email as well.
I just want to say this brand of catheter, it's called Cure Ultra. It's shorter than any catheter I've ever seen, any pre-loop catheter I've ever used, and it's the perfect length. So you can check this out, and I think it's very environmentally friendly. It doesn't it doesn't have a lot of plastics coverings. Yeah. So and it's cheap. It's the cheapest pre-loop catheter.
One of the things, like people are talking about UTIs, one of the things I found helpful was taking a probiotic specifically designed for women. Like Natural Factors for women, or Renew Life for women. They seem to, especially if you've had to take antibiotics in the past, I just find it very helpful, and I get less infections because it makes seems like your bladder's more robust and can fight off infection better.
I tried to take cranberry supplement, but the side effects was it would make my stew very hard. It would affect my bowel movement, so I stopped taking them. But I think the juice, like maybe the unsweetened cranberry juice, will work better than a supplement.
Possibly.
I've heard
Yep.
pineapple juice too. Like, I feel like there's all sorts of things that people try, and you know, same with everything. What works for one doesn't necessarily work for everyone.
Vitamin C can be helpful too.
Mm-hmm.
Yeah.
Okay, I'm gonna go back to the chat box. So Tori just mentioned that in the video, Michelle demos using gauze to hold the catheter. Again, we'll put that link in the thank you email. Nancy put in Cure-Ultra and then pre-lube catheter. That's the name.
Yeah,
Nancy,
that's the
of it?
brand.
The brand, okay. And then a comment. So I may have missed it in Jackie's video, but how do you work around if you're using a pull-up? Wouldn't you have to remove that in order to IC?
I use it's not a pull-up, but a kidney shaped pad, and because it's not done up on the sides, I can pull it down and out of the way. When I used to wear underwear, I just pull them to the side, but I don't know how bulky a pull-up is in the center. to pull it to the side? Maybe somebody who has experience wearing them would know.
Yeah, you can, yeah, I did it pulling them down for so many years, and then I'm like, yeah, why don't I just kind of slide it to the side? And it does actually work, so it's a good possibility.
Okay, thanks.
Thank you. Yeah, thanks. There's another comment, looks like Utiva, hopefully I'm saying that right. Cranberry PAC is more effective than juice and some of the other cranberry products.
That's true.
There's another little tidbit. So I recognize the time, it's 4:05. If anyone else has anything, any last minute questions, anything else they want to share, any tips and tricks that they've learned? Another question. Oh, okay, so the cranberry pills, they're saying you can purchase them on Amazon. Thank you for that. Yeah, so if there's any parting words, any last comments, please feel free just to unmute yourself and ask or let us know.
Don't give up though. Like if it's hard the first time doesn't mean you can't do it.
Mhm. And maybe if you're practicing, practice with somebody that's there with
Yes.
you in case anything happens.
Yes, yeah. Once your body becomes more agile, you're more independent, and it's in better shape than when you were at rehab, you will be able to do it much easier.
Mhm. Marnie, you had a question. Sorry, Marnie, is that your name?
Yeah,
Okay,
sorry.
yeah, you
Sorry,
had something.
I'm late. Thanks, Diane, for reminding me about it. But yeah, no, it definitely gets easier. Like I've been in a chair for 40 years. One thing, I'm sorry I missed it, but I read, or it was actually on a catheter package saying that female catheters didn't have to be lubed. I've never lubed one pretty much like for the last 30, 40 years that I can remember. So I guess that could be causing some damage, I guess, that the idea behind it, right?